Morning sickness is common, but vomiting all day, every day is not. If you can't keep food or water down, this may be hyperemesis gravidarum. Hyperemesis gravidarum, or HG, is a severe form of pregnancy vomiting. Unlike normal morning sickness, it can cause constant nausea, frequent vomiting, weight loss, and dehydration. Difficulty doing daily activities. HG often starts early and can last beyond the first trimester. Seek medical help if you have vomiting more than 3 to 4 times a day, unable to keep fluids down, dark urine or very little urination, dizziness, weakness, or fainting, weight loss during pregnancy, dry mouth, or rapid heartbeat. These are signs of dehydration and electrolyte imbalance. Common reasons include very high pregnancy hormone levels, HCG, sensitive stomach or gut, multiple pregnancy, twins, triplets, history of HG in previous pregnancy. HG is not psychological and not your fault. Treatment may include prescription anti-nausea medicines, 4 fluids for dehydration, vitamin B6 or supplements, hospital care in severe cases. Early treatment can protect both mother and baby. Pregnancy vomiting should never make you feel helpless. If nausea is severe, speak up. Help is available. Follow for daily pregnancy safety and awareness videos.